I think another key part of that equation is we know that there's people who have high LDL and they get heart disease. There's also people with high LDL who don't get heart disease. One of the big things that seems to differentiate the outcomes there is the amount of oxidized LDL that one has. And what's a really good way to get high ox LDL? It's to fill your LDL particles with linoleic acid.
Yeah, because it's very susceptible to oxidation. Yeah.
So again, bird's eye view here, when you think about sort of all the literature on this and all you've done, how has that affected your orientation to the food you consume? And how would you advise people with respect to soybean oil and other high linoleic acid oils and foods?
Yeah. So in terms of just starting with, okay, we all need some LA, it's like, well, don't worry, plants make it, you're going to get it. Unless you're fasting for days or weeks on end, you don't really have to worry about that. In between my undergraduate work and my graduate work, I actually worked in a lab in Spain for a couple of years. And this was during the toxic oil syndrome in the early 1980s. And it was right at the same time as the AIDS epidemic. There were tens of thousands of people who were getting sick. A lot of their symptoms were like AIDS, but they didn't know where it was coming from. They found out in the end that it was coming from adulterated cooking oil. So these chemists, these sort of half-baked chemists, took rapeseed oil, which now I'm seeing people are using it in gourmet cooking, but rapeseed oil is grown in France. It's very cheap. It's a very easy thing to grow. And very often that's what's used for industrial oil. And so they add in a chemical dye to make the oil look dark green so you don't want to eat it, right? So these chemists would buy this industrial oil made from rapeseed. So rapeseed oil is edible, but once you add the dye aniline, it's very, very toxic. They said, well, we're just going to boil off the aniline. Right? It's just like how we're going to boil it off and then we're going to sell it as olive oil. Okay. So again, this is the early 1980s. Franco was dead for not too many years. They did not have any labeling system on food in Spain at the time. And so people would buy, particularly in the poor neighborhoods, large vats of what they were told was olive oil. And people got sick and died. Many people got sick.
It was boiled rapeseed oil.
In the end, they set it off. They said, well, it must oxidize lipids, not being good for you. In any case, at the time in Spain, is that the main scientific advisor asked everybody to stop doing whatever research they're doing and, if possible, study the toxic oil syndrome. So they were telling people in Spain was a very Catholic country at the time, do not have babies. If you've had the toxic oil, do not have babies. You don't know if you can pass it on. And so they weren't even quite sure what it was at the time. And then they settled on this oil. And so I was working in a lab studying the mutagenicity of pesticides, and we switched our research to look at the mutagenicity of this toxic oil.